If your blood pressure machine just flashed a high number, you might be thinking, do I need to go to the A&E right now? Pause. Because most of the time, a single high reading at home is not an emergency. It's just a misunderstanding. And today, I'll show you how to tell the difference between a true high blood pressure and a temporary spike. I see this all the time in the surgery. People come in worried because they check their blood pressure at home and they got a reading 170/100. Then I check it in the clinic calmly and properly, and it's completely fine, normal. So here's the first big lesson. One high number does not automatically mean you have hypertension. Hypertension is a pattern, not a single scare. So what do the numbers even mean? Because this is where many people get lost. The top number is the systolic, which means the pressure when your heart squeezes and pumps blood out. The bottom number is the diastolic. That is the pressure when your heart relaxes and refills. So if you see 140/90, that means 140 is the squeeze pressure and 90 is the relaxed pressure. And blood pressure naturally changes all day. It goes up with stress or activity and comes down with relax or sleep. So one reading is just a snapshot, not the full story. Also, many people think high blood pressure always comes with symptoms. Some say, I can feel it. I'm feeling dizzy or headache. My blood pressure is high. That idea is mostly nonsense. High blood pressure is usually silent, which is why it quietly damages the heart, the kidney, or the brain. There's a reason why it is called the silent killer. So if you feel fine now with a high blood pressure, that doesn't mean it's harmless long term. It only means it's not an emergency right now. And we're about to separate these two. So here's the key difference. A single high reading is often a temporary spike. It could mean that your body is in high alert mode. Common causes of high readings are anxiety or panic, pain, caffeine or energy drinks, nicotine, rushing around, exercise, poor sleep, a full bladder, and some medications can also cause it as well. This doesn't necessarily mean your baseline is high. It only means that your body was reacting. So the question isn't, was it high once? The real question is it consistently high even when you're calm? And the way you check your blood pressure actually matters more than you think. Bad technique creates false emergency. So if you want to check your blood pressure, do this. Sit quietly for at least 5 minutes. Keep your foot to the ground and your back supported. Don't talk. Use an arm cuff if possible, and take 2 readings 1 minute apart. If you measure when you're tense or you're talking or your arm is dangling or just after activity, you push the number up and scare yourself for no reason. So if you get a scary number at home, do this. Number 1, don't keep checking every 30 seconds. You only give yourself more anxiety and push the pressure up even more. Sit calmly for 5 minutes and recheck again. Take 2 readings and write them down. Then check again later in the day when you're much calmer. What we care about is your average over time, not the worst number you caught during a stressful moment. Now, when should you go to the ER? You don't go for the number alone. You go when the blood pressure comes with danger signs. That means symptoms that show that your end organs are being damaged. So if you're watching this video, call your emergency number or go to the ER now. If high blood pressure comes with stroke signs, that is face drooping, weakness on one side of the body, speech problems, or vision loss. Number 2, chest pain or sudden pressure, severe breathlessness, collapse, seizure, or severe confusion, sudden severe tearing, chest or back pain. And also if your blood pressure is repeatedly above 180/120, even without symptoms, don't ignore it. You should be getting same-day urgent medical advice. So depending on where you are, that might mean urgent care, same-day clinic, or the emergency if that's your only option. So remember, a single home reading does not mean you have hypertension. It often means stress, timing, or technique. In my next video, I will cover true hypertension, how it is diagnosed properly, what damages it can cause over time, and the best treatment for it. If you want that, comment hypertension down in the comment section. And also tell me the highest blood pressure reading you've seen at home. Stay safe and see you next time.